Innovation to me is such a broad word that before we can really do anything with that word in terms of organizational improvement, we really have to define what does that mean. And Naomi attended a breakfast that I held back in May, and that was one of the first questions we tackled is, for each organization, what really is innovation? Because innovation can be anything from a small process enhancement to completely disruptive new technology or a new medical device or a new procedure, and everything in between. So the first thing we have to think about when we talk about innovation is what does innovation mean? But where I think is more important for organizations in the healthcare space, especially on the provider side, hospitals, clinics, those kinds of things, it isn't just about what are the new disruptive ideas, what are the new innovative ideas. There's lots of great ideas, and we're going to talk about that in a bit. I might actually even get you to come up with some. But I think where the difference between the most successful organizations is going to be versus the ones that aren't going to be as successful is in the application of those ideas. So it isn't just about coming up with new ideas, it's how do we increase the adoption of those ideas? How do we take those ideas and broaden the impact as much as we can, both within our own organizations, but also outside? And I think to me, what I see as the organizations that are the most successful right now are the ones that are able to take those ideas, implement them, integrate them, and broaden the impact of them. My first thought was expected results. So if we're going to collaborate, do we expect that the results are going to be better than if we did this on our own, right? So I think that, results can, and when I say results, I don't necessarily mean financial. I think to me that's a separate component of it, which is equally important. But do we think that by collaborating either internally or externally, that we're going to actually get better results from what we're trying to achieve? As relationship, again, going back to trust, do we trust that they've got our best interest in mind? One, I don't think it was mentioned, I just threw out the word timing. And I mean timing in two different ways, and I'll talk about both of them. Timing being, is it the right time to collaborate? Are we as an organization ready to collaborate at this time? But also timing from the perspective of, if we collaborate, is that going to add a significant amount of time to achieving the results that we want? So it's a bit of a trade-off to say, well, if we think that we can get here on our own, but if we collaborate, we can get here, but it's going to take an extra year or 6 months, that's a trade-off that you have to think about, right? Are we willing to wait an extra 6 months to get a better outcome or a better result, or are we better off just trying to do it ourselves? Obviously, costs or ROI, are there additional costs? Are there additional savings? Is there a bigger return if we collaborate? And then the one thing which I always talk about is impact. So if we collaborate, can we have a broader impact? So not just the results will be better on an individual case-by-case basis, not just it's financially better for us, but can we actually have a broader impact? And that might mean broader within your own organization or across the healthcare industry as a whole. The second is, how can you provide more value to patients in an area where the delivery of care is changing? So there's two parts to this question. So how do you offer a better outcome to patients where the delivery model is changing? But sort of a corollary to that is, how can you change the delivery model to get better outcomes for your patients? So part of it is things change that are out of our control. How do we adjust to those? How do we benefit and leverage those? But then the other part is, how do we actually proactively look to make these changes? I know this is stuff that you guys do every day. But again, areas of improvement, that's where you can look. Are you clear on the direction that the organization is trying to go? So we talked about sort of clarity of message a little bit in saying, if this is the direction that the executive team says we want to take this hospital, we want to be the #1 pediatric hospital in North America. Does everybody understand that? And does everybody understand their role in helping this place become the #1 pediatric hospital in North America? What does that mean for all the various departments and levels of this organization? Because each level, each department, is going to mean something different in terms of outcomes, expectations, performance boost, and things like that. But are you clear on the direction? And I think the most important second part of this question is, do you have the right people for the current and future needs of the organization? So if you know that this is where the organization wants to go, we can assess the people that we have here and say, well, we've got the right people for where we are. But the important question is, do we have the right people for where we want to be? It's sort of that classic thing where I'm sure we've all had this thought, whether it's within our own organization or you go to a restaurant or another business and you say, I know that there's a better way to do this, right? We've all had that thought in our heads. You look at something and say, this makes no sense. You know, if any of you have rented a car recently, when you go to a rental car counter, you sit there for 15 or 20 minutes, and all I keep thinking to myself is, this is not the best way to do this. Like, I could do all of this stuff online before I even check in. Why do I have to show up and give them all of my information like we're 25 years ago, right? So we've all had those moments where we've been doing something, standing at a counter in front of somebody saying, there's no way that this is the most efficient, most effective way to do that. So when you've got that in your head, then you just have to take it that one step further and say, if I know there's a better way to do it, I need to start investigating that a little deeper and say, now let me figure out what that way is. Right? You wouldn't do that if you're necessarily, standing at a rental counter. You're not going to give them advice on how to do it better. But you're doing it when you're in your own jobs, saying, I know this doesn't make sense. There's got to be a better way to do it. Take it that step further and say, now what would I change? How could I go about making that change?
For more information, contact the phone number or the email address on the screen.